Aortic valve regurgitation is a fancy word for the aortic valve leaks. Now, the aortic valve is a valve in the heart that makes blood go only one way, from the left ventricle, a big powerful chamber, to the aorta, the pipe that takes blood around your body. When the ventricle contracts, blood goes through the valve and the valve opens beautifully. When the ventricle relaxes, the valve closes nicely and blood doesn't rush back into the ventricle, causing it to dilate. So blood can only go one way. And that's really important. In fact, there are a number of valves in the heart that serve the same function in different portions of the heart. Now, in aortic valve regurgitation, blood leaks into the ventricle. And initially, the ventricle can cope with this. In fact, the ventricle is very good at coping with this for some considerable time, even in the presence of severe aortic valve regurgitation. But after a time, the ventricle starts to swell. And every time the heart beats, blood goes out and then back in. And patients eventually start to get tired, lethargic, they'll get breathless, and eventually, if left for too long, will develop heart failure and other valve problems and heart rhythm problems within the heart. Now, the key task of your cardiologist or your cardiac surgeon is to understand what the cause of the leak is, what the effect of the leak is, and whether or not there is now an indication to operate on the aortic valve. Now, let's start with the types of conditions that can cause aortic valve regurgitation. Well, we've mentioned one in previous videos, and that is when you've got calcification on the aortic valve, which causes it not to open properly, causing it to be sclerotic or perhaps stenotic, but doesn't close properly. So because it doesn't close properly, there's leak. In another condition where we've got floppy aortic valves, usually a congenital anomaly, every time the valve opens, it's fantastic, but every time it closes, it just flops back into the ventricle and blood leaks into the ventricle. This is a congenital anomaly that's often associated with an architectural change in the valve itself. Often these valves are bicuspid, two-leaflet valves, instead of tri-leaflet or three-leaflet valves. But even three-leaflet valves can sometimes be floppy like this. Infections of the aortic valve can cause it to leak. Other congenital conditions can cause it to leak. Patients with a condition called Marfan syndrome can develop a condition where there is floppy aortic valves and also concomitant disease in the aortic wall as well, which makes it weak and subject to aneurysm formation. In fact, patients with bicuspid valves and some patients with trileaflet valves can develop weakness of the aorta because the congenital tissue, the connective tissue that is not holding the aorta properly and the leaflet spreads apart and can't meet. And so really, a combination of tests performed by your cardiologist and your heart surgeon will help us to elucidate the cause of the regurgitation, the severity of the regurgitation, whether it's causing secondary problems, and if it's causing you symptoms and it's severe, what will be the best treatment for you. The most important thing we have to do is define whether or not your aortic valve regurgitation is isolated, i.e. it's just the valve that's the problem, or whether the aorta itself is the problem. And as I indicated earlier on in this particular video, sometimes in bicuspid valve disease and some patients with tri-leaflet valves, the aorta is the problem, where the aorta swells because it's weak and the leaflets don't meet. And sometimes in these conditions, we are able to repair the aortic valve simply by dealing with the aortic surroundings. So it's very important when we work patients up to understand what is the best treatment for them, to also understand what the cause of the leak is so we can understand the best treatment. For example, if you have got a bicuspid aortic valve with aortic enlargement, then you might actually need not just an aortic valve treatment, but also treatment of the aorta to replace it before it becomes an aneurysm. And there are other videos that are far more relevant for you if you want to learn more about bicuspid valve disease or aortic root aneurysms, which will be linked at the end of this video. Now, if you need an isolated aortic valve replacement, i.e. we need to replace the aortic valve because it's leaking and causing symptoms, either swelling of the heart or symptoms, then you have generally two main options open to you. Replacement with a tissue valve, pigs or cows, or replacement with a mechanical valve. Tissue valves are brilliant in one aspect. They don't need you to be on a blood thinner. Tissue valves don't need that, you see, because they don't clot. Mechanical valves have the advantage that they will last pretty much forever, but the disadvantage of warfarin. Now, there are newer mechanical valves made of carbon called the Onyx valve, for example, and these do allow doctors to run the blood thinning at a lower level, which can be a little safer for you. But of course, as you get older, being on warfarin is not a good idea. So the rule of thumb with replacement in the aortic valve position, unlike for the mitral valve, in the aortic valve position, if you're under the age of 50, then mechanical valves are the right answer, generally. Otherwise, you're going to need many repeated treatments. If you are over the age of 70, then tissue valves are the better answer because you really want to avoid warfarin. And in between, it's a lifestyle choice. Do you want a permanent solution and no more treatments with a mechanical valve? Or would you rather have a tissue valve and avoid warfarin and accept that you might need further treatment in the future? What's changing the dynamic is the introduction of a new treatment called TAVI, Transfemoral Aortic Valve Implantation. This is a way by which we can put aortic valves in through the groin to replace your diseased aortic valve. Now, we can't do that very effectively in aortic regurgitation, but we can replace failed tissue valves. And the data is growing here to suggest that this might be a real option for people who've had a tissue valve in the past and have tissue valves that are now failing and need them to be replaced without the need for surgery. Now, one of the other advantages of aortic valve replacement these days is we can perform the operation through a keyhole incision, either in the form of a little cut through the breastbone, leaving most of the breastbone still intact, and patients will heal quicker. With this, they have less pain, less bleeding, less risk of serious infection. But even better than that these days, in the hands of certain groups of teams, certainly the team here at the Keyhole Heart Clinic, we can perform this operation through a small cut between the ribs called anterior right thoracotomy. And the beauty of this one is that it's the same operation, but there's no broken bone, and it heals in 7 or 8 days. And patients don't feel any soreness. They can move around very easily. And so there's no doubt that these days the treatments that we have to replace your aortic valve have advanced quite considerably, and the treatment is very safe and effective. And the key is to understand what the cause of the valve problem is, so we can understand exactly what the treatment is that's required, and also know exactly when the treatment is required. If you want to learn more about the other types of aortic valve regurgitation problems, particularly in the context of aortic aneurysms and bicuspid valves, click some of the other videos at the end of this video and they'll help you. If you want to stay in touch with us, subscribe to the channel, and as new videos emerge, you will get an alert on your smartphone letting you know that they're there and available for you to watch if you want to. I hope that's helped. Bye for now.